In this module, we will give some background information on Project Embark, including the project's aims, who we consulted, and what we did. Independent Community Living Australia, ICLA, received funding from the NDIA through the Ministry of Health under an Information Linkages and Capacity Building grant to deliver Project Embark. The aims of Project Embark were to increase understanding about the benefits and ways of accessing the NDIS, and to increase the capacity of consumers and those who support them to successfully navigate the NDIS. Project Embark's target group were people experiencing psychosocial disability and homelessness, or who were at risk of being homeless. We consulted this group along with service providers, family, friends, carers, and clinicians who support these individuals. The project targeted 8 local health districts with the highest rates of homelessness. We consulted local health district and primary health network representatives, along with mental health and homelessness service providers. We engaged with almost 400 people from the target group and over 100 service providers. We did this by visiting organisations and services, including homeless hubs, crisis shelters, and community drop-in centres.
Project Embark focused on mapping out the barriers and challenges that prevent the target group from accessing the NDIS, and upskilling service providers through information sharing, capacity building, and linking people to services that can provide support throughout the NDIS application process. We developed a suite of resources to address some of the barriers identified and to build capacity. We submitted a report to the Ministry of Health with the project's findings and recommendations to improve NDIS access for this group. From our consultation with both service providers and people experiencing homelessness and a psychosocial disability, Project Embark identified the key barriers that prevent NDIS access across the target regions. The NDIS access requirements are a barrier itself, as it can be difficult to evidence disability for people experiencing homelessness. We found that people from this group typically don't have clinical records and often have no regular medical practitioner. The transient nature of the group makes it difficult to obtain the supporting evidence needed for an NDIS application. We found that service providers often lack capacity and incentive to support people to access the NDIS. Many organisations are already understaffed and under-resourced and can't spare time to go through a lengthy application process. The application process itself is lengthy, confusing, difficult to understand, expensive, and deficit-based. This can be triggering for people experiencing psychosocial disability, as the process is not a pleasant experience. The NDIS application process is difficult to navigate for the target group due to a range of factors, including poor literacy skills and a lack of computer access. In addition to the challenges of the application process, information that is circulating about the NDIS can be contradictory and at times is often unclear and complex. Another barrier identified throughout consultation is that it can be difficult to engage people experiencing homelessness and a psychosocial disability. This is due to the transience of people experiencing homelessness, being uncontactable as a result of not having a phone or a fixed address, and the negative perceptions of government systems. Individuals may also be intoxicated or experiencing symptoms of their mental illness, which makes engagement difficult, and the process can be triggering and often traumatic. The NDIS is not a quick fix. It does not provide a solution to the immediate problems faced by the people experiencing homelessness, who are more focused on meeting their basic needs, such as food, shelter, water, etc. Project Embark used a co-design process by consulting with people experiencing homelessness and a psychosocial disability to map out these barriers. This helped us to identify the factors preventing people from engaging with both services and the NDIS. Some common themes we heard from this group are that people don't know where to start when it comes to the application process, or have difficulty accessing services that are needed for the process.
We used a survey to further map the barriers in accessing the NDIS for this group. 60% of people had not heard of the NDIS or understood what it was. 76% of the people we surveyed had never tried to apply for the NDIS, despite a large proportion of them potentially being eligible. 77% of people said they would not feel confident in completing an NDIS application on their own due to a lack of understanding of the process and where to start. Of these people, 94% said they would feel confident in applying for the NDIS if they had someone to support them throughout the process. These figures show there is a significant need for engagement of this group to increase awareness of the NDIS and develop understanding of the process. There is also a need for people to be supported throughout this process. Throughout the project, we use some strategies to engage with people experiencing homelessness. Assertive outreach is essential to engage this group, which we did by visiting places where people experiencing homelessness visit, including homeless hubs and community spaces. We built engagement activities around immediate needs by holding barbecues and providing other incentives such as fruit, biscuits, and gift cards. As one of the barriers to this group in accessing the NDIS is that it does not provide any immediate benefit, we found providing immediate incentives can be a good way to engage people. We acknowledge that people working in the homelessness, mental health, and NDIS sectors are not directly resourced to do outreach and support the target group to gain access. But we know many of you are probably doing some of this work anyway. Project Embark identified some opportunities to effectively support an individual to access the NDIS, which helps to overcome some of the barriers discussed earlier. We can do this by supporting people to understand the NDIS, including the eligibility requirements and the supports available for people with a psychosocial disability. It is essential to make the NDIS relevant to the person who might apply. You can support someone to access the NDIS by assisting them with gathering the evidence they need and writing supporting letters. This may include helping them to book a doctor's appointment or even going with them to their appointment to help with communication and make sure the access request form is completed properly. Support can be provided in obtaining documentation from health professionals by calling up and getting them sent to yourself so that they're all in one place, with the consent of the person that you're supporting. USBs are also useful for a person to store all their own documents on. A person can also be supported to understand and complete their access request form.